IPN's Legislative Response. In this third and continued podcast segment of the IPN Network series, we'll discuss IPN's involvement and direction to legislators at both the state and federal levels.
Now, Larry, you mentioned legislation. So what needs to be done by the independent physicians legislatively to provide direction to healthcare policy and the value-based healthcare movement, I mean, here in the state of Florida and even nationally?
Yeah. Well, you know, it's interesting because the value-based care movement in America is not a partisan, it is a bipartisan movement. Both sides of Congress understand very clearly that if healthcare is at $3.6 trillion today, representing almost 18% of our GDP, and by 2027 it's going to go to 20% of the GDP at over $6 trillion, that's completely unsustainable. And everybody understands that. So what do you do about it? Well, you've got to have some type of a healthcare shift in alternative payment models, and value-based care is that. But let me give you a couple surveys. There was a 2018 health survey, and it showed that 69% of Americans favor congressional action to limit consolidation of healthcare. 60% viewed purchasing of independent practices by hospitals as a threat to affordable care. And 25% saw that consolidation as a direct threat to their health care in America. And if that is what the U.S. population feels, those messages have to be driven in legislature, both state and federal, to make sure that the big money, which is the American Hospital Association, the American Pharmaceutical Association, the American health insurance programs, which represent, and even the legal profession, that represent these huge lobby groups that give millions and millions of dollars to the people that decide the legislation out there, that we stop protecting these people and do what's right for America. And that is really our message in a nutshell.
So this has been fascinating, but let me just ask you, so what message do you have that everyone needs to know about healthcare in the U.S.?
You know, I want to address that and then let April address it. Understanding today that healthcare costs are approaching nearly $4 trillion in this country at over 18% of the GDP. And that, by the way, the next closest country is 9% of their GDP, and that's Japan, of all the mature countries. So we are twice the next number 2 in the world. And if our healthcare system were an economy, we would be the 7th largest economy in the world, just our healthcare system. And yet we're number 25 in regards to ranking of life expectancy and overall healthcare quality in the world. We're number 25. It's interesting, but so how do you really? What's our best ways to do this? I think number one, we have to continue to educate the consumer about the importance of choosing independent doctors and choosing care in an independent environment when it's appropriate. I think the second thing is we've got to educate, and we're doing this, local businesses about the importance of supporting an independent network like IPN. We've got to work with lawmakers to create policies that support all the things that we're talking about here. And it's all about making sure that patients, when you have the need for care, and I want to say this, that $3.6 trillion that we spend today, that's not health care, that's sick care. We need to start delivering health care, which is preventative care, not sick care, which is what we pay for today. And that's the message that, we can't continue to allow people to go to the ER for bad colds because they worked all week and they played golf on Saturday, and Saturday night they didn't feel good, so they go run up a $3,000 bill for a bad cold when they could go to a Minute Clinic and get a $15 prescription. Those are the kind of things, and I think copays for ERs need to be Our copay for our Alliance Health program is going to be a $500 copay to the ER. You better have a reason to go to the ER. And if you go to the ER, you better hope you get admitted for the right reason, because then that ER payment is waived. But if you go to the ER for a bad cold and you're covered by Alliance Health, it's going to cost you $500. Where if you go to a primary care doctor, it may cost you $25.
Or high acuity urgent care.
Yeah, or high acuity urgent care. And you know, it really boils down to, how do we get that message across to Americans, to citizens, to patients? You know, you've got really 3 different types of patients out there. You've got the young, healthy, I'm invulnerable, I don't need health care. And they never go. And if they do get a bad cold, they do go to a minute clinic or something like that, or an urgent care, and get a Z-Pack, and they're good to go for the next 5 years. And then you've got the middle-aged people that have maybe 1 or 2 chronic illnesses, that, and particularly diabetes is a big one, that people have to monitor to make sure that they don't get into an acute care environment. And then you've got our elderly, which on average over age 65 have anywhere from 3 to 6 different chronic illnesses, and they're the ones that are driving a significant piece of healthcare today. And I think it's about understanding the dynamics of each of those buckets, to not only understand the social determinants that drive these healthcare issues, but what we can do as healthcare providers to understand and to help impact that. And those are the messages that I think. April, you want to jump in here?
I agree 100%. Physicians, at least in an independent market, they are setting their practice up to address the different buckets of the populations. So if we're in Florida, it doesn't matter what physician you are, you're going to have at least 50% of your practice is Medicare. It's just how it is. This is the state we live in. And then, of course, the rest is broken up, 25-25. You have the millennial bucket and your, what is the next one called? But obviously your middle age bucket with 1 or 2 chronic conditions. And they tend to be actually the better consumer, so to speak, I think, because they do visit their physician at least twice a year, and they get their physical, and they do that kind of stuff. So it's all about preventative health care, but like Larry had mentioned too, we are currently acting reactively, and we have to act proactively if we're going to try to get costs down.
Yeah. You know, truly, to kind of wrap this up, independent physicians are the solution to rising healthcare costs in America. And healthcare is local, healthcare is personal, and that's where we need to make sure that we're interacting. And not only are we protecting and preserving the independent practice of medicine, we're protecting and preserving that patient-physician relationship so that we never lose that. And I can tell you, when a physician joins a hospital, that patient-physician relationship is minimized, because the physician really doesn't own those patients. The hospital does. And that makes a big difference when you talk about patient satisfaction and even the personal side of healthcare.
Well, also, too, employed physicians are pressured to see an enormous amount of patients a day, where an independent physician, it's his own business or her business. So if they want to limit it to 25 patients in a day, they can. Because they do want to get to know their patient. They want to know what social determinants, may lead to other issues or chronic conditions down the road. So it's overall better care.
Yeah, let me give you a couple more stats that I think you'd be interested in. In 2017, a healthcare group, surveyed 750 hospitals in America, just a small sampling. And during that 2017, of those 750 hospitals, there were 24 million ER visits by what they considered chronically ill, chronic condition patients. And they still saw that 4.3 million of those ER visits were avoidable, representing an estimated savings just in that one little bucket of over $8 billion. Now, another thing that we need to understand, that from 2007 to 2014, hospital pricing for inpatient care grew 42% in that 7-year period. Against independent physician costs grew 6%. So if you take the comparison of the two and you continue that out to today, hospital costs not only are up here compared to physician costs down here, but they're growing at 7 times what independent physician costs are being reimbursed for. And if that isn't a message that I think everybody can understand, I'm not sure what we need to be doing here.
I should probably follow with, we are not against hospitals.
Yes.
We are just for independent physicians, and we understand.
And the patient.
And the patient. There are 15% of the care does need to be in a hospital setting, and all of our physicians have privileges at the hospitals. They do surgeries at the hospitals. They, work the best they can with the hospitals. So we're not against hospitals. We just believe, and like Larry said, it is the right care at the right time, at the right place for the right cost. And that's...
So we're going to continue to not only provide direction for employers, patients, consumers, we're also going to try and drive direction with healthcare policy for legislators that we're actively involved in at both the state and the federal level.
Wow. Well, thank you both. Thank you for being the champions for this cause, and we look forward to hearing more about it.
Thank you.
Thank you.